Stem cell therapy is a new branch of medicine capable of changing the face of human disease and alleviate suffering of patients. Today on Sound Health, that is our focus. I'm Olasunbo Modupe. Welcome to the show. The first 1,000 days of life is critical to a newborn. The World Health Organization says this period is critical to the survival of any child, as several early life factors can contribute significantly to the child development and well-being. For Esther Oluwanifemi Oladapo, it was a torturous one. She was born ill and healthy, but had a high fever at 6 months and was treated for malaria.
I took her to hospital. They tested her, they ran a series of tests. They said it's malaria. After getting home, the temperature continued, not stopping. It was so hot to the extent, if she's breathing, the breathing is very hot. So I took her back to the hospital. They gave her drugs for malaria. But suddenly in the midnight, she convulsed. So immediately she convulsed, we rushed her to the hospital, exactly 3 a.m. So we rushed her to the hospital, getting to the hospital, she couldn't close her eyes. She was opening her eyes, she couldn't close it. But the doctor gave her an injection, private hospital. So from there, they ran some series of tests. They said the blood is already dried, that she needs blood, that we should go and get the blood. We get the blood, they continue the treatment, but we didn't see any improvement on that treatment. So we have to refer her to Mercy Hospital in Lagos Island. From there, we stay a month. So they discover, after running a series of tests, they discover that it's meningitis in Mercy Hospital. So they treated her. I stayed a month and some week in the hospital. Later, they discharged.
Esther is 12 years old today. She's not only paralyzed, she cannot talk and will be difficult for anybody to believe she is 12 years old. Her condition is worsened by the fact that she suffers recurrent seizures, a sudden attack occasioned by repeated convulsion. Esther Oladapo has been diagnosed of lumbar meningitis, an infection of the fluid and membranes around the brain and spinal cord. She also has cerebral palsy, a group of disorder that affects movements and muscle tone or posture caused by damage to the immature brain as it develops, most often before birth. However, fortunately, the good news is that Esther can be ill and healthy again with the help of stem cell treatment.
I see her walking again. I so much believe with what we have seen that people like her, though it's quite very expensive, stem cell treatment is not a joke. So with what we have done so far, we've been taught with testimony on her personally. We want to believe that those who have actually overcome through stem cell too should actually overcome, because the insertion will be directly to the brain, and the cells that have damage in the brain will regenerate over time and she will come out of it.
Health experts say with good treatment in a foreign hospital, Esther can live a normal life. You're still watching Sound Health on Lagos Television. Dr. David Ikudayisi, a specialist in internal medicine, geriatric medicine, and regenerative medicine, will share his expertise on stem cell therapy. David Ikudayisi is also a diplomat of American Board of Internal Medicine, based in Tampa, Florida, United States of America. Welcome to the show, Dr. Ikudayisi.
Thank you for having me on the show.
To start with, what is stem cell therapy?
Stem cell therapy is the use of stem cells to
Okay.
So you are using the cells. Sometimes some people relate it like organ transplant, whereby the organs are limited, in organ transplantation, but stem cell therapy, you have a lot of cells to use. It can be from the umbilical cord, it can be from the bone marrow, or from the fat of the patient.
Okay, so how does it work? To a layman, can you please clarify or expatiate further?
Okay. Yeah. So let me put it this way. Every woman is formed from an egg and a sperm, and then that becomes one cell, and that one cell multiply and divide. Stem cells are cells that can multiply and divide, or they can differentiate into different cells or tissues. Inside the human body, the stem cells that we use for these stem cell therapies actually work by what the medical scientist team we call paracrine effect. That means cell to cell communication. So they really don't differentiate in human beings, but they get attracted to the area of disease, damage, and tell the cells in that area to start multiplying, differentiating, and repair the injury faster than it would have happened under natural.
Branch of medicine, Dr. Ikudayisi, has it been certified?
Yes, this branch of medicine is relatively new, about 15 years, but that's regenerative medicine.
Okay.
Prior to that, stem cell therapy was initially considered things like bone marrow transplantation that started in 1968. But recently, scientists found out that you can do more than just treating blood cancers or cancers of the bone marrow using bone marrow. You can now apply the bone marrow to treat other medical conditions. Okay. So the certification of it is in most countries has not been done, but it is a lot of clinical research is going on. They've gone through different phases in clinical research, and some of them are already being used, depending on what you are treating. There are some conditions that the treatment is still in research phases, while some other ones like orthopedic conditions, joint pain, things like that, are already being practiced clinically. And they are safe.
Okay, kindly share with us diseases or conditions that can be treated with stem cell therapy.
The most common one would be the orthopedic conditions,
Okay.
like joint pain. Some people have arthritis. Autoimmune conditions are responding very well as well. People that have acute stroke.
Okay.
I use the word acute, meaning when the nerve cells in the brain are programmed to die after having a stroke, you can reverse that process if adjunct stem cell therapy is applied within a short period of time. If it is chronic, then it takes longer, because once the neurons, the nerve cells are dead, you cannot bring them back to life, and it takes longer for new nerves to form. So neurological disorder, autoimmune conditions, orthopedic conditions like joint pain, diabetics are responding very well. Many conditions can be treated, but it doesn't cure HIV. It does not cure hepatitis, although it improves the condition of these patients.
Okay, what about cerebral palsy and maybe meningitis? Have you heard of the cure
Yes.
through stem cell therapy?
Those of us in regenerative medicine, we do not like using the word cure.
Okay.
Because there are still certain things in clinical trials. For meningitis, I believe the Germans a couple of years ago were the first one to use bone marrow stem cell transplantation to treat meningitis.
Okay.
Because meningitis is not common in children, it's not treated on time, there could be seizure afterwards or even symptoms like stroke afterwards. If you treat with bone marrow transplant, the Germans found out that all these after effect symptoms can be avoided. About cerebral palsy, it can also be used at the center where I work. A couple of cases have even been done. There are even Nigerians that have benefited from this. Some came to John Hopkins, they were not accepted. They found that this can be done in Nigeria. And then the patient that could not stand up or walk after 2 sessions of fat derived from the patient, and stem cell was derived from the fat derived adult stem cell. The patient was able to stand up and walk some steps, of course, with also use of physical therapy, which has been done for about 9 years. No result until adult adipose stem cell therapy was added, and within 3-4 months, the patient was able to stand and walk.
Okay, I understand there are types of stem cell therapy, the autologous and the allogenic stem cell treatments. Are there other types? And can you please shed more light on these types?
Okay. Autologous is probably the only one I can say has no side effect.
Okay.
Autologous means you are using your own cells, your own body part to treat yourself. It's like you're either using your blood to treat yourself, like people on dialysis, the blood leaves them, the machine cleans it up, and it comes back to them. The Jehovah's Witnesses don't like blood transfusion, so they use their own blood. That's autologous, your own body cells. Whether you get it from your bone marrow or you get it from your fat, that is autologous stem cells is the same. Now, allogenic, it means the donor is different from the recipient. In that case, you have to do a proper match to minimize the risk of rejection. And siblings, family members are always the most commonly used donor. So there's still risk with that. Talking about stem cell therapy generally, there are mainly 3 types. The first 2 are called pluripotent, and those first 2 are embryonic stem cells with therapy, which most countries don't allow. It has religious controversy, and because it involves potential future human beings. The second type under pluripotent is induced pluripotent stem cells. That's when you take cell from a patient, you take it to the lab, you reprogram it, you manipulate it, you multiply it before giving it back to the patient. Those 2, the pluripotent stem cells, that is embryonic and induced pluripotent, they have a significant risk. Until earlier this year, US finally started a clinical trial in human beings, saying that they find a way that they can control induced pluripotent. And the goal is to try to use the white cells in the body to, program it to cure solid tumor cancers in human beings. I said that there are 3 types. The third one, adult stem cell therapy. That is what is clinically safe, clinically available. And the source of that is when you use somebody's bone marrow for the transplantation, or you use umbilical cord blood or tissue of a newly born baby, or you use stem cell derived from the patient's own fat, which you get from the stomach area. And anything adult stem cells is not about age, but it's about fully formed woman, and that is clinically safe. That is what is. If you hear that it's being done somewhere, anywhere in the world, it's adult stem cell therapy. If you hear that it is clinical stage trials, it is induced pluripotent stem cells.
Okay.
One more thing, adult stem cells therapy are done the same day, except the umbilical cord blood.
All right then.
The one from the fat and one from the bone marrow, you take from the patient, you give it back to the patient, which is under the autologous. That is clinically safe.
Okay. How long does stem cell therapy last?
Well, it depends on the condition that is being treated. Some of them are known to last for the rest of the patient's life. For example, if a bone marrow transplant is done for some cancers of the blood, those do last long. If a patient is being treated, let me give an example of, let's say, erectile dysfunction, and the patient also have diabetes.
Okay.
If the diabetes is not being treated, and only the erectile dysfunction that is being treated, which is a result of the diabetic, then after about 2-3 years, the diabetics will overpower the effect of the stem cell therapy that was done earlier. So it depends on the condition. It can last a couple of years, and it can last for decades.
Okay, I want you to be more specific. Now, what about cerebral palsy or meningitis? Has it been successful in that area? Has treatment been successful in that area?
Now you're talking about neurological disorders.
Yes.
First of all, to make it clear, any neurological condition that is not being treated, addressed at the acute stage, what I mean is within less than 3 months,
Okay.
those conditions will require multiple sessions
Okay.
of stem cell therapy intervention in
Okay.
order to even get meaningful results.
Okay.
But if let's say a stroke is being addressed within a couple of weeks, then the neurons that were programmed to die from the deficiency of oxygen to the brain
Okay.
are going to recover fully with stem cell therapy. So those will, as long as that person's blood pressure or the cause of the stroke is being kept under check,
Okay.
then there will be no problem from that particular incident.
Okay.
If the problem is being addressed after chronic or after 3 months or so, then one treatment session will not be enough to treat adequately that neurological disorder, because the nerves are probably dead in most cases. So you have to stimulate the surrounding neurons of that injury area to start multiplying, differentiating, to take over some, if not all, of the functions that are deficient.
Okay. Is stem cell therapy available in Nigeria?
Well, before I say, the answer is yes for adult stem cell therapy, because stem cell therapy is a broad topic.
Okay.
There's no embryonic stem cell in Nigeria. Induced potent stem cell therapy, which is in the one manipulating research stage, is not in Nigeria. But there is a part of the adult stem cell therapy that is coming to the research center in collaboration with Nigerian Institute for Medical Research. Once that is fully in place, Nigeria will be one of the first 5 centers in the world to experience using their own stem cells from their own body fat to cure solid tumor. It means the solid tumor will shrink and it will disappear. And if it has traveled far, it will also disappear. Nigeria has been promised a blueprint for that protocol once the government is ready, So that research will jumpstart.
Okay, so we are looking at certification in the nearest future.
Yes, for that cancer treatment.
Okay.
With patients' own stem cells.
Okay, so how affordable is stem cell therapy?
That's a relative word when it comes to affordability.
Okay.
Health is wealth, and you cannot put price on patients' life.
Okay.
But as it is right now, with any medications or whatever, when things are new, they are relatively expensive. But that is why, let me say, regenerative medicine or adult stem cell therapy will benefit almost every human once this is fully certified, accepted around the world. But as it is as of today, it's kind of expensive.
Okay.
You know, if I should say.
Okay. Are there side effects and safety concerns to be wary of?
Yes, there are side effects for some types of stem cell therapy, and there is no side effect for the autologous.
Okay.
With every procedure, there is side effect if it is not done properly. Even the autologous that is safe can still have side effect if it is not done properly.
Okay. So what are the success rates, and have you recorded success in this field? Can it be quantified?
Okay, are you asking about me particularly or generally?
Generally and personally.
Okay. When there's no 100% guarantee in medicine, but that being said, it is regenerative medicine or adult stem cell therapy that is giving the highest response rate in most conditions where orthodox medicines has given up. For example, let me use IVF, in vitro fertilization. If a patient is less than 35 years of age, you know, the success rate is about 40%, and that significantly dropped to about, I believe, 6% or so from age 42 and above.
Okay.
With adult stem cell therapy, you are looking at something between 60 to 80%.
Wow.
Now, if you are using bone marrow transplant, the age affects the success rate. If you are using fat-derived stem cells, the age does not affect the success rate.
Okay. Okay, on that note, what is your final point as we wrap up this interview segment?
Yes, there's too much of hype going on about stem cell therapy, and I'd like to caution people, because even here in the United States, the FDA has to get involved to regulate all these stem cell clinics that are popping up. Yes, it's a good area of medicine with a lot of great potential, offering solutions, for diseases that currently cannot be treated by our orthodox medicine.
Okay.
I would just caution anybody that is trying to either fly to China, India to do their research properly, know what they're getting into, make sure that they've seen people who have gone to those centers before they invest a lot of money in it, because if it is not well regulated yet all over the world, that means there may be centers that have been doing the wrong stuff. Yes, it has great potential, but also people should be cautious, because they might be getting things that can lead to maybe problems later on in their lives. So that is my advice. And of course, anything that is let me say autologous is safe. It's your own body part. You cannot go wrong. But in US, FDA approved umbilical cord blood for some conditions.
Okay, thank you so much, Dr. David Ikudayisi, for sharing your thoughts and expertise on stem cell therapy.
Thank you for having me on your show.
That has been Dr. David Ikudayisi, specialist in internal medicine, geriatric medicine, and regenerative medicine. He has been sharing his expertise on stem cell therapy, a new branch of medicine capable of alleviating suffering of humans. Sound Health continues with trending and home essentials. Please stay with us. The program continues in a moment. Seek professional help if stem cell therapy is your option. That has been Sound Health today. Hope you've learned one or two things about stem cell therapy. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at TV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.